This video, we're going to discuss how to properly use PT straps for a C-section scar through the various stages of recovery. We break it down into 3 stages. 1, the early stage. 2, the intermediate stage. And 3, the advanced stage. It's important to note before using PT straps, the surgical incision needs to be well healed and all the scabbing has sloughed off naturally. Depending on the patient, this can be anywhere between 2 and 4 weeks following C-section. The only other precaution using PT straps is not to use this with patients that keloid. Anytime using PT straps, you must always do 2 things to ensure better performance of the tape. 1, prep the area by cleaning the skin with alcohol solution to remove any body oils or lotions. And 2, after applying it to the skin, you must give it at least 10 minutes for the adhesive to dry and attach to the skin. The early stage of a scar is described as approximately 0 to 4 weeks, with 0 being the point of once it's healed, not the surgical date. The scar is newly healed and there are no scabs. The scar is pink in color. There is mild to moderate sensitivity at the scar, with mild inflammation at the scar as well. Placement for PT straps in the early stage. Of course, we've already wiped down and prepped the skin so that the oils and the body lotions off the skin. Once that has dried, placement in the early phase is going to be as such. We take the flat edge on each side and we're going to have the flat edge parallel to the incision. But yet in the early stage we're going to straddle the scar. Now we've already alcohol wiped the patient down, so the skin is prepped and ready. I'm going to tear the paper backing, remove one side. I'm going to place it on one side of the incision, making sure that the adhesive side is well away from the scar. I'm going to take the paper backing off the other, and we're going to place it on the other side of the scar. Again, well off. So we're looking at about 1 centimeter straddled on the scar. I'm going to give it a little rub, rubbing it down, making sure the edges are making good contact with the skin. This is going to assure a better mobilization. Now, for a C-scar, depending on the length of the scar, we may put 1, 2, 3, depending on what you want to achieve. I like to put 2 because the edges have a tendency of being problematic as the scar ages. So I'm going to put the second one down. Again, I'm going to tear the paper back, take one side off, and we're going straddle. You can see I'm clearly off the scar, and remove, and there. Good. There we go. So once down in place, we got to give it some time for the adhesive ends to dry and really hold on to the skin. To effectively perform the mobilization, we want to hold on to the base of the strap. Okay, we're going to hold the base and we're going to deliver a low-grade mobilization in certain directions. We're going to go clockwise 5 to 10, then 5 to 10 counterclockwise, 5 to 10 inferior superior, 5 to 10 medial to lateral, 5 to 10 for the twist and the lift. The lift is really important to the scar mobility, and it's very difficult for us to do in the clinic, and it's virtually impossible for the patient to do this at home. That 5 to 10 repetitions each direction is going to take approximately 1 minute. In the clinic, this can be done as part of your manual therapy treatment, especially at this stage, since the scar is usually really tender and being aggressive is not advised. What studies show us is low-grade frequent mobilization has the greatest impact on the scar mobility. In addition, during the patient's therapy session, support staff or the patient themselves can actually mobilize the scar in between exercises or in between modalities, only adding to the frequency of manipulating the scar. After educating the patient on how to clean the area with alcohol, where to apply, and how to actually mobilize, my directions are for them to apply the PT straps every morning. Then, whenever they use the bathroom, prior to redressing, they can deliver the 5 to 10 repetitions each direction to each PT straps. This will take approximately 1 minute per PT strap, making this process quick and easy and pain-free. Upon completing their repetitions, they can redress and continue on their day. I recommend them to self-mobilize at least 5 to 10 times a day, and using the PT strap for the first 4 to 6 weeks every day is critical. It is recommended the tape to be removed at the end of each day. This allows the skin to breathe through the night and then reapply the following morning. As the scar matures, it will progress into the intermediate stage. The intermediate stage presents sometime between week 4 to week 10. Scar is no longer pink in color, but more of a flesh tone. There's a little to no skin sensitivity on the scar, little to no pain with palpation, no localized inflammation at the scar. At this intermediate stage, placement of the PT straps advances. The earlier phase, the straps were straddling the scar, but now, the intermediate stage, we're going to bring the flat edges of the PT straps to butting up against each other. So we've already prepped the skin with alcohol. It's nice and clean. We're going to tear and we're going to place down. So now we are going to go right along the edge, right on top of the scar. I'll tear the paper backing of the other side, and just like so. So now there is no space between the flat edges of the straps, so it's making a nice circle right across the top. But the line, the straight line, is still running the length of the incision. Now, why we do this? Because as the edges come closer, we find the penetrating depth of the mobilization goes a little deeper. Again, we're going to put 2 pieces down to mobilize the C-section scar effectively. So tear the back, I'll put another piece on the other side in the same way. So now we're getting that full length of the scar covered. And because we're in the intermediate stage, skin is more mature, it's a little tougher, so we don't have to worry about removing the tape and pulling any skin off. At this stage, the patient can now be positioned in a mild stretch during mobilization. Each position should be comfortable, and they may or may not feel any stretch on the scar in the position. The patient should feel the mobilization at or around the scar, but it should be pain-free. So some common static stretches I like to use during mobilization. I like the side bend with the patient supine. So I'm going to pull her middle section toward me a little. Her arms are going to go up overhead. She's going to side bend away, and I'm going to pull her legs away. So now we're creating a nice side bend in her trunk. So this puts a little different stress across the scar. So here in the clinic, I'm going to mobilize, okay? So I'm going to grab a hold, and I'm going to deliver the 5 to 10 repetitions each direction, clockwise, counterclockwise, superior, inferior, medial lateral, and the twist and the lift. Another one I like to do is go ahead and we're going to do a little Thomas stretch. Okay, so scoot to your right. So we're going to just drop the leg into the Thomas stretch. Again, we are putting a different kind of stretch on the underneath. So it's going to put a little different encouragement on the scar tissue itself. If this pulls too much, if any of these positions are too much, we have to back off a little bit, make the stretch a little less. The Thomas stretch, a lot of times, the leg itself is too much, so I have to put something supportive underneath it. But again, it's up to the patient's comfort. We'll drop the leg off, and I'll deliver, again, the low-grade mobilization, all directions. Either myself, support staff, or the patient can do this while they're in the stretch position. Side-lying leg drop with the arm reach. Here, we're going to have the patient on their side, reach up with this arm overhead, good, and I'm going to take this top leg and I'm going to take it and drop it off the back side of the table. Again, we're putting a little different emphasis across the lower trunk, which pulls on the fascial layers and the scar differently than just in neutral. So I'm going to have her in the position, I'm going to reach through, and we're going to mobilize. As usual, 5 to 10 repetitions each direction. Next one, side lying trunk twist. Put the patient in side lying. I'm going to bring the knees up. Then I'm going to have her arm up and she's going to twist into it. So now, once again, we're putting just a different directional stress on the scar tissue and on the lower tummy. Once she's in position, again, I grab each strap and I deliver the low grade 5 to 10 reps each direction. Quick, easy, no pain, but yet you want them to feel it, but no pain. Supine over the pillow. Here, I want to put a little extension encouragement on the back. So I put a little pillow. You can use a Bosu ball, you can use a couple pillows, bolster, anything you have available to put a little extension into the low back. Their arms are going to go up overhead, whatever that comfortable is. And here, so I have a little extension, I'm going to deliver the mobilization with the patient in this position. Again, depending on where they are at, maybe you have a greater extension, maybe you have less. It all depends on the patient's tolerance, but that gives you some room to grow. Again, I'm going to do my 5 to 10 repetitions each direction, pain-free, getting good feedback from the patient, making sure that I'm not being too aggressive with this. In the frog position, it just puts another different stretch on the underlying fascia. You can have the hands comfortable or overhead, depends on what you want to accomplish. Again, I'm going to go through and mobilize 5 to 10 repetitions each direction. In addition, in this stage, I have the patient doing more proactive self-mobilization with them in different static stretch positions. I recommend they do this 1 to 2 times a day at home. First one is the simple leg off their bed. So the patient at home, they're instructed to just take one leg off, and then they're going to grab a hold and then deliver the low-grade mobilization, the 5 to 10 reps each of the directions. In addition to the single leg drop, I like to do the spine twist. So the patient will turn on their side. You can see they can easily do this on their own bed. Bend the knees up, and one arm is going to twist, and that frees your other hand to deliver the self-mobilization. The advanced stage is described as any scar older than 10 weeks. There's no pain or tenderness at the scar, no swelling, and the scar is flesh in color. I get asked all the time, can I use PT straps for old scars? The answer is definitely. There's no harm in trying, and I've had great results using PT straps in conjunction with physical therapy to reduce pain, improve joint range of motion, and improve functional mobility with C-section scars as old as 25 years old. In the advanced stage, the angle of the PT straps now changes. Before, we were running along the line of the incision, but now we're going to go perpendicular to it. So I'm going to take tape and I am going to concentrate on the end. Let's just say this is the end that's puckering, okay? I'm going to put the line of the strap perpendicular to the end of the scar. Place it down and Move the backing on the other side and place it down. Again, the flat edges are butting right up against each other, but now the line of the strap is perpendicular to the line of the incision. So we get it down, we give it the time to adhere to the skin, and we're ready to go. With their home program, I have them concentrating on the twist and the lift to unpucker those things, to really pull the tissue in that Z plane. So one of the ones I like to have them do at home is the leg swing. They're going to twist and lift on the PT strap. They're going to swing that leg forward and back. Now, initially starting, they can start small, and then according to their tolerance, they can get bigger and bigger. So I'll have them swing 5 to 10 times. The next one I like having them do is the stepping back lunge. They're going to twist and lift the scar and step back with one leg and back. So they're stepping back into a lunge. Again, you can start with a small lunge, progressively getting wider and longer in the lunge, just putting a little bit more excursion across those deeper fascial layers. Another technique, an exercise for the patient to do, is the swing and step back. It's a combo of the two. So they're going to grab a hold of the PT strap, twist and lift. Hold that lift. They're going to swing and step back into a deep lunge. That's it, back and forth. Good. 5 to 10 reps just like that. And you can start with a small lunge, progressively making the lunge deeper and deeper and deeper. Next, have the patient go into a side angle. So stepping with their left leg and the back leg. Perfect. Side angle. So you can see we're putting a little different stretch, and this is something they can do at home. Twist and lift while she's in this position. Here, since it's more static, it's more about the different angles. So twist and lift 5 to 10. Final one I like to use is with a little bit more of a twist. So the patient's in a lunge. Good. And she's going to lean back. Good. And mobilize with this hand. So the free hand is going to grab a hold. Again, all she's concentrating on is the twist and the lift. At this stage, we're not too concerned about all the other directions because we want to try to work on that unpuckering. So twist, lift, and it's a static stretch, but it's multi-planar. We're having her multiple joints, multiple directions. Good, she's twisting and lifting, 5 to 10 reps. Using the ball is another way to really put a different intense stretch across the lower tummy. So I have the patient sitting on the ball, and they're going to twist and lift as they recline back and reach with the other arm. So that really is putting a deep extension on that lower tummy, and come on back up. We can even do some eccentric loading. So sit all the way up. Good. So here, again, she's going to twist and lift and hold that as she slowly peels down. So that eccentric loading, imagine the abdominals are contracting and lengthening at the same time. So that puts a really intense, aggressive torque, you can say, while she's lifting and twisting on the PT straps. Great. Again, 5 to 10 reps. In conclusion, PT straps offers a structured, aggressive approach to C-section scar management that evolves with tissue healing. By combining consistent application with stage-appropriate mobilization, clinicians and patients can effectively improve scar mobility, reduce restrictions, and restore functional movement. When used correctly, it becomes yet a simple but powerful tool both in the clinic and at home.